Hi everyone and welcome back to my channel. In today's video, we'll be going through some top multiple choice questions for nursing exams. This question will cover both the normal objectives and the NCLEX method of questions. Let's dive right in and start with question number 1. A client with heart failure is prescribed furosemide. Which finding indicates the medication is effective? A. Increased blood pressure. B. Decreased peripheral edema. C. Weight gain of 1 kg in 2 days. D. Elevated serum potassium. Let's take a look at option A. Furosemide usually lowers blood pressure. It doesn't increase it, and this is due to fluid reduction. So option A is not our answer. Furosemide is a loop diuretic that is used in heart failure to reduce fluid overload by increasing urine output. Now, by doing this, the decreased peripheral edema shows that excess fluid is being removed through urination. So this means that the medication is effective. In option C, weight gain would suggest that the fluid retention is getting worse, not improving. And in option D, furosemide causes hypokalemia, that is low potassium, so it doesn't cause elevated potassium serum. So the correct answer here would be option B, decreased peripheral edema. That means the fluid retention is reduced. Excess fluid is being removed via urination. Question 2. A nurse is caring for a client who has abdominal surgery 12 hours ago. Which finding requires immediate intervention? A. Incisional pain rated 7/10. B. Absent bowel sounds. C. Bright red drainage saturating the surgical dressing. D. A temperature of 37.8 degrees Celsius. In option A, pain is expected after surgery and it should be managed because it is not immediately life-threatening. In option B, absent bowel sounds is normal within the first 24 to 72 hours post-abdominal surgery due to temporary paralytic ileus. Looking at option C, a bright red drainage saturating the surgical dressing after 12 hours post-op would suggest hemorrhage or active bleeding, and this is a priority because it is a life-threatening complication. Immediate intervention is required for this situation. In option D, a slight elevation is common after surgery because of the inflammatory response, but it is not an urgent concern at 12 hours. So our answer here is option C. This would indicate active bleeding or hemorrhage, and immediate intervention is required. Question 3. What is the normal range of systolic blood pressure in adults? A. 80 to 120 millimeters of mercury. B. 120 to 140 millimeters of mercury. C. 140 to 160 millimeters of mercury. D. 160 to 180 millimeters of mercury. The normal adult systolic blood pressure range is usually from 90 to 120 millimeters per mercury, but some references would extend it lower to 80 millimeters of mercury. So the values will consistently vary. I mean, if the values are consistently above 120 millimeters of mercury, this may indicate pre-hypertension or hypertension, depending on the diastolic pressure. In option B, this range may suggest pre-hypertension, so it is not normal. A range of 140 to 160 would indicate stages 1 to 2 of hypertension, while a range of 160 to 180 indicates stage 2 hypertension, and this is a significant health risk. So, based on the question that we've been asked, the normal range of systolic blood pressure in adults would be option A, 80 to 120 millimeters of mercury. Question 4. A nurse is teaching a client with asthma about using an albuterol inhaler. Which statement indicates correct understanding? A. I should use the inhaler daily to prevent attacks. B. I will use the inhaler when I start having shortness of breath. C. I should hold my breath for 2 seconds after inhaling. D. I should shake the inhaler after I use it. Now, first, albuterol is a short-acting beta-2 agonist, and it is also called a rescue inhaler. So let's look at option A. This would be incorrect because daily use for prevention is for controller medications, not albuterol. Albuterol is used during acute asthma symptoms, that is wheezing or shortness of breath, and this is used to provide quick relief by relaxing the bronchial smooth muscles to enable breathing. In option C, this will be incorrect because the client is already struggling for breath, so they they shouldn't hold their breath for 2 seconds after inhaling. The client should hold their breath for 10 seconds in order to allow full medication absorption. So once they inhale, they are meant to hold their breath for up to 10 seconds for the medication to be fully absorbed. In option C, the inhaler should actually be shaken before use in order to mix the medication properly. So looking at the options that we've been presented with, the correct answer to show that the client understands how to use this would be option B. They should use the inhaler when they start having shortness of breath or when they start wheezing. Question 5. What is the instrument used to measure blood pressure called? A. Stethoscope. B. Thermometer. C. Sphygmomanometer. D. ECG machine. A stethoscope is used to listen to heartbeats, breath sounds, and throat cough sounds during BP measurement, but it doesn't measure BP itself. A thermometer is used to measure body temperature. A sphygmomanometer is the instrument that is used to measure blood pressure, and it usually comes with a stethoscope in order to listen for throat cough sounds. It consists of a cuff and a measuring unit and also a bulb for inflation of the cuff. An ECG machine records the electrical activity of the heart, but it doesn't measure blood pressure. So our answer here is option C. Question 6. What is the approximate weight of the liver in a healthy adult? A. 1.8 kg, B. 1.4 kg, C. 0.9 kg, D. 2.3 kg. 1.8 kg is slightly heavier than average, and it will be considered on the higher end. Remember, the liver is the largest internal organ in the human body, and in an healthy adult, the average weight would be about 1.4 kg, which is approximately 3 pounds. The vital functions performed by the liver includes detoxification, bile production, metabolism, and storage of glycogen. In option C, 0.9 would be too light for a normal healthy adult liver, and 2.3 kg is much heavier than the normal range, and this could indicate an enlarged liver. So based on the options we've been presented with, the correct answer would be option B. The approximate weight of the liver in a healthy adult is 1.4 kg or 3 pounds. Question 7. Which blood vessel are the smallest? A. Veins. B. Capillaries. C. Arteries. D. Arterioles. Veins carry blood towards the heart and they are quite large, so they are not the smallest blood vessels. Capillaries are the smallest blood vessels and they are just wide enough for red blood cells to pass through one at a time. They are at the site of exchange of oxygen, nutrients, and waste between the blood and the tissues. The arteries carry blood away from the heart and they are also large, just like the veins. While arterioles are small branches of arteries, however, they are still larger than capillaries. So, based on the options we've been presented with, the smallest blood vessels are known as the capillaries. Question 8. A nurse is assessing 4 clients. Which client should be seen first? A. A client with pneumonia and oxygen saturation of 90%. B. A client with fracture requesting pain medication. C. A client with diabetes who needs morning insulin. D. A client scheduled for discharge teaching. Let's look at the options. A client with pneumonia and an oxygen saturation of 90% would indicate a low oxygen saturation. This is potentially life-threatening. Now, according to triage and prioritization principles, clients with airway, breathing, or circulation issues should always come first. That is the ABC of triage and prioritization principles. So any client that has trouble breathing or has issues with their airway or circulation, they should always be attended to first because their situation is life threatening. In option B, the client with a fracture requesting pain medication should be addressed perhaps later because this is not life threatening. Pain can be addressed after urgent issues have already been addressed. In option C, while this is time sensitive, giving the clients their morning insulin, while it is time sensitive, unless the client has symptoms of hyperglycemia or hypoglycemia, this is not as urgent as the oxygenation issue. In option D, this is the lowest priority and this can wait after acute needs have already been addressed. So our answer here would be option A. Just to recap, when prioritizing, always consider the ABCs first. That is airway, breathing, and circulation. So this client that has an oxygen saturation of 90% should be seen first. That is the first priority. Question 9. Which hormone stimulates the gallbladder to contract and release bile? A. Glucagon. B. Gastrin. C. Insulin. D. Cholecytokinin. Glucagon raises blood glucose by stimulating the liver to break down glycogen. So it doesn't stimulate the gallbladder to do anything. Gastrin stimulates the stomach to produce acid for digestion. This is different from the scenario we've been presented with. Insulin lowers blood glucose by facilitating glucose uptake into the cells, while cholecytokinin is a hormone that is released by the small intestine when fats and proteins enter the stomach. So it stimulates the gallbladder to contract and release bile into the small intestine in order to help digest fats. So our answer is option D. Question 10. A nurse is preparing to administer a blood transfusion. Which action is most important? A. Use a 24-gauge IV catheter. B. Verify the client's identity with another nurse. C. Warm the blood before administration. D. Check the client's temperature after transfusion. In option A 24 gauge IV catheter is too small, and rather an 18 to 20 gauge is recommended for blood transfusions. In option B, verifying the client's identity with another nurse is the most important safety step before a blood transfusion. This is because giving blood to the wrong patients can cause a life-threatening transfusion reaction. So, it is a critical safety check that is required by standards of care to always verify the client's identity with another nurse. In option C, warming the blood is only necessary in specific cases such as massive transfusion or cold sensitive patients. And in option D, while this is important for monitoring, it is not as critical as preventing a mismatch before starting the transfusion. So, patient identification verification is the highest priority when administering blood, and that is option B, verifying the client's identity before the transfusion with another nurse. Question 11. Which of the following is the antidote for morphine poisoning? A. Adrenaline. B. Atropine. C. Naloxone. D. Flumazenil. Adrenaline or epinephrine is used for cardiac arrest or anaphylaxis, but not for opioid poisoning. Atropine is used to treat bradycardia, but not for opioid poisoning. Naloxone is an opioid antagonist because it binds to the opioid receptors and reverses the effects of the overdose. This includes morphine, heroin, and other opioids. Flumazenil reverses benzodiazepine overdose, but not opioids. So, if a patient shows respiratory depression or altered consciousness from morphine, naloxone is the antidote of choice. And this brings our answer to option C. Question 12. Which diagnostic test is used for tuberculosis? A. Urinalysis. B. Chest X-ray. C. Mantoux test. D. Blood culture. Urinalysis checks urine for abnormalities, but not for tuberculosis. A chest X-ray can show lung damage that is caused by tuberculosis, but it cannot confirm the infection itself. A Mantoux test or a tuberculin skin test is used to detect latent or active tuberculosis infection. Now, the way it is done, a small amount of purified protein derivative is injected under the skin, and the reaction is measured after 48 to 72 hours. Blood culture detects bacterial infections in blood, but not specifically tuberculosis. So, the test that is used for tuberculosis is option C, the Mantoux test. Question 13. What is the normal range for fasting blood glucose? A. 50 to 80 milligrams per deciliter. B. 70 to 100 milligrams per deciliter. C. 100 to 140 milligrams per deciliter. D. 140 to 200 milligrams per deciliter. Fasting blood sugar is usually measured after at least 8 hours without food, and a normal fasting glucose level is around 70 to 100 milligrams per deciliter. Our answer here would be option B. If it is at a level of 100 to 125, this could indicate pre-diabetes, and if the level is from 126 and above on two separate tests, it suggests diabetes. So the answer here is option B for the normal range of fasting blood glucose. Question 14. Which cranial nerve is responsible for vision? A. Trochlear. B. Olfactory. C. Optic. D. Oculomotor. The trochlear nerve controls eye movements. The olfactory nerve is responsible for smell. The optic nerve transmits visual information from the retina to the brain, making it responsible for vision. The oculomotor nerve controls most eye movements and pupil constriction, but it is not for vision itself. So the answer here is option C. The optic nerve is responsible for vision, and the optic nerve is the cranial nerve too. There are four cranial nerves. The first one is the olfactory nerve, that is the nerve 1. The second one is the optic nerve. The third one is the oculomotor nerve. And the fourth one is the trochlear nerve. But the one responsible for vision is the optic nerve. That's the nerve 2. Question 15. Which of the following factors can increase blood pressure? A. Obesity. B. Meditation. C. Low sodium diets. D. Regular exercise. Obesity increases the workload on the heart, and this can lead to hypertension or high blood pressure. So in order to avoid this, it's good to keep a healthy body weight. Meditation reduces stress, and this can lower blood pressure. Low sodium diet also helps to reduce blood pressure, especially in people sensitive to salt. Regular exercise strengthens the heart and usually lowers blood pressure over time. So out of these options, the only factor that increases blood pressure is option A, obesity. Question 16. A client receiving IV heparin develops hematuria. What should the nurse do first? A. Slow the infusion rates. B. Stop the infusion. C. Administer vitamin K. D. Notify the provider. Hematuria is blood in urine, and this indicates active bleeding, which is usually a serious complication of heparin therapy. The first thing to do is to stop the source of bleeding, and this means immediately stopping the heparin infusion. Slowing the infusion is not safe because bleeding is already occurring. Administering vitamin K is also not effective for heparin. Notifying the provider should only happen after stopping the infusion because the bleeding is an emergency. So the correct thing to do first is option B, stop the infusion. With anticoagulants, any sign of active bleeding requires stopping the drug immediately before taking other steps. Question 17. The pulse is commonly checked at which artery? A. Brachial artery. B. Carotid artery. C. Radial artery. D. Femoral artery. The brachial artery is located in the arm, and this is often used for blood pressure measurements, or in infants, it is used to measure pulse. The carotid artery is located in the neck, and it is used for emergencies or when the radial pulse is weak. The radial artery is at the wrist, and this is the most common site for checking a pulse because it is easily accessible, it is superficial, and it is safe. The femoral artery is located in the groin, and this is used mainly in critical care or cardiac emergencies, but it is not used for the routine pulse checks. So our answer here is option C, the radial artery. That is the most commonly checked artery for pulse. Question 18. Which isolation precaution is used for patients with tuberculosis? A. Airborne precaution. B. Droplet precaution. C. Standard precaution. D. Contact precaution. Tuberculosis spreads through tiny airborne droplets when an infected person coughs, sneezes, or talks. Now, For this kind of disease, the isolation precaution will be airborne, and this would require an N95 respirator for healthcare workers, a negative pressure isolation room, or the patient should wear a surgical mask when outside the room. This is the best kind of precaution for tuberculosis. Droplet precaution is used for infections that spread by larger respiratory droplets, such as influenza. Contact precaution is for preventing infections that are spread by direct or indirect contacts. That is like the MRSA. Standard precaution is basic infection control that is applied to all patients, but it is not specific to tuberculosis. For tuberculosis, you need to implement airborne precaution. That is option A. Question 19. Which of these is the universal blood donor group? A positive, B negative, C, O negative, D, AB positive. For this, we'll be going with option C. The O negative blood has no A, B, or RH antigens on the red blood cell, so it can be safely transfused to any blood type in emergencies. A positive, B negative, and AB positive have specific antigens and they cannot be given to all blood types. So O negative is the universal donor, while AB positive is the universal recipient. So AB positive can receive from any blood group. However, O negative is the universal donor. Question 20. What is the term for low blood pressure? A. Hyperlipidemia. B. Hypotension. C. Hypertension. D. Hyperglycemia. Hyperlipidemia is high levels of fats in the blood. It could be cholesterol or triglycerides. Hypotension means low blood pressure, and this can cause dizziness, fainting or syncope, and inadequate blood flow to organs. Hypertension is high blood pressure, so know the difference. Hypo means low, while hyper means high. Hyperglycemia is high blood sugar levels. So based on the question, the term for low blood pressure is option B, hypotension. This brings us to the end of the part 1 video for the nursing MCQs. Don't forget to like, comment, and share, and also hit the subscribe button so that you'll be informed when the part 2 video will be dropping. Thank you for watching, and I'll see you in the next video.